Well, welcome everyone, and thank you very much for joining us. We're delighted to welcome the Splunk team and the AccuHealth team here to our Lorca Live video. The focus of today is very much going to be on, as we're calling it, analytics as a startup enabler, and really drilling down into the way that Splunk and AccuHealth have worked together, specifically post-pandemic, to demonstrate a real success story when it comes to their partnership. So, I mean, before we sort of kick off into the detail, Stephen, it would be great if you could introduce yourself and give the audience a bit of detail about AccuHealth.
Absolutely. Hi, everyone. My name is Stephen Samson. I'm the CEO of AccuHealth. My background is actually cybersecurity. While I was in cybersecurity for about 25 years, I was working with Accenture as well as PwC and different various operational roles, generally around cyber. And I saw an opportunity in remote patient monitoring. And when I was looking around the marketplace, I was seeing that a lot of people were trying to create new remote patient monitoring telehealth platforms from the ground up. And when I was looking at the core of the situation, I realized that Splunk is the obvious choice when it comes to any sort of remote patient monitoring platform, because all we're doing is taking data and we're visualizing it, and then we're presenting it to the healthcare providers. So I wanted to pilot it. I was fortunate enough to have some really good Splunk resources in my colleague network, and we got our remote patient monitoring platform up in a matter of weeks. And I think it was about 9 weeks we had the most advanced remote patient monitoring platform in the marketplace, and it was solely due to Splunk. The framework by itself that just lends itself for the visualization capabilities that we required was such an enabler, where our competitors are struggling trying to integrate with different products and different hardware products. We were able to do it overnight. So that's my background on what AccuHealth is. We're a remote patient monitoring platform in 37 states across the United States, saving patients' lives and earning more revenue for doctors who use our platform and services.
That's fantastic, and we'll definitely sort of go into a lot more detail around specifically how that partnership has worked. Ahead of that, I suppose, Garen, it would be great if you could give us a bit of background on yourself and your role at Splunk.
Yeah, sure. Thanks, Dave. Yeah, so I'm Garen Ingleby. I'm responsible for Splunk's OEM embedded licensing business, which is part of our global partner organization. I'm based in our San Francisco headquarters and have been involved in IP licensing and embedded licensing most of my career, primarily at Adobe for 13 years and a few different startups in between before joining Splunk. And what we're doing is basically providing our horizontal analytics platform as an embeddable component that can be included within a partner's branded applications, deployed as SaaS or on-premise. And it's really, an alternative to trying to develop big data analytics capabilities in-house.
Thank you. And I know, it would be great to get a bit of background on your role at Splunk as well.
Absolutely. So I'm Oleg Kostukovsky. I'm a part of the partner organization within Splunk. I'm Garen's counterpart, covering all of the technical aspects of our relationship with OEM partners, helping them adopt our solution, integrate solutions with their own products. And my background is going back to 90s, I guess. I've been in engineering roles for a long time with both small startups as well as the large companies. I spent over 10 years with Oracle in different roles. Last 8 years, I am a solution architect, and at Splunk, I'm focused on OEM partners.
That's great, thank you. And before we sort of, I suppose, delve into sort of the AccuHealth case study, it would be really good, Garen, if you could just maybe shine a bit of a light, because obviously the OEM solution is relatively new, and it would be really good to just get a bit more detail, I suppose, on how it came about and the real driving force behind it from a Splunk perspective.
Sure. Yeah, we've been at this for a while. We have quite a number of OEM partners around the world, but what we really wanted to do with this new OEM program is lower the barrier to entry specifically for startups in terms of being able to embed our horizontal analytics platform into their products. And the way we were looking to do this was by providing a free production license as part of this program. And specifically, this is Splunk Enterprise, our core product that can be embedded in their applications. And we wanted to, as part of that, provide a very transparent license model, because I know, as being part of venture-backed startups in the Bay Area here in California, that there's a need to understand, what happens along the life cycle of this type of relationship. And when you grow, how does the license model grow with you? That needs to be absolutely transparent. So that was another key goal. And we know cash is king, so the free production license was also certainly a key element. We think really the significant value for a startup is to take advantage of Splunk's analytics technology is really to enable a monetization of their data in novel ways, that wouldn't otherwise be possible without this type of capability that Splunk is providing.
And Oleg, from your point of view, it'd just be good to understand, I suppose, from a technical perspective, this data proliferation and the challenges that provides, but also, I suppose, the benefit of using Splunk when we're seeing sort of exponential growth in data year on year.
Yeah, absolutely. As you can imagine, Garen and I were being part of the Splunk partner organization, and we see a lot of software startups focus on different type of application use cases. And so AccuHealth is obviously in a remote healthcare delivery, but we also work with the startups focus on various security use cases, IT infrastructure monitoring, Internet of Things, and many others. And we see a common theme and common problems that products team within startups are struggling to solve. And the problem it has to do with collecting, processing, and managing vast amount of data, heterogeneous data that coming from a variety of different data sources. And most importantly, how do you extract intelligence out of this data? And Splunk Enterprise, that's a product that is that we offer to ISVs and startups under our OEM program, is designed to help software companies address exactly those challenges. It is a turnkey solution for big data analytics, and I realize it's a grossly overused term, but it's what it is. It's a complete solution to help startups deal with a large amount of data, and it includes everything you would need to collect, store, manage, correlate, analyze, and eventually visualize data and present it to your customers. And it really helps startups in two different ways. First of all, it helps startups with a fast time to value. It's extremely important, right? When you are on a limited budget, when you are struggling and looking for your first customers, your time to value is extremely important. And it's what a lot of most startups' first priority is. But probably most important, or even I would argue more important than time to value, is really ability to scale your business and future-proof your business. And it's exactly what our platform offers. Both bring your product to the market fast, but also build enough scalability into your solutions so that you can scale to, from 1 to 10 initial customers to hundreds and hopefully thousands of any user in the future.
And presumably, Stephen, that was a driving force behind your sort of decision making. I mean, it would be really helpful, I suppose, to just, if you could just take us back to that decision point of when you were looking at using Splunk, and really sort of understanding what the decision criteria was, and why, just a bit more in depth about why Splunk was the right solution.
Yeah. So when we first started this, I didn't know the OEM program existed. So what we actually we started building Splunk on a trial license that we had, and our Evelyn, that's our platform, that's what we refer to it as. And we started building on Splunk when we first started the trial license. Then when we realized that this had legs, we went and we purchased Splunk Enterprise. And because of the size of the data that we are and the size of the client we're going to be, it was extremely challenging to get the attention that we required. It was difficult to, and I'm not saying anything bad about Splunk. It was just, when you're phoning somebody for the smallest license possible, you generally don't get the most attention. And getting the license was difficult. When we finally did get the license, renewals became difficult. Getting support was challenging. And then we went to Splunk conference, and we actually ended up speaking at conference. Fortunately, I believe Oleg was in attendance, and he pulled us aside and said, you'd be perfect for the OEM program. Once we started talking with Garen and Oleg, and they explained to me the program, it was a no-brainer. I now have, anytime I need any sort of support or anything like that, I can automatically email Garen and Oleg, and I get a response very quickly. When we have issues with Splunk, we obviously use Splunk support, but again, I have somebody that is attentive to our needs if something is staying in queue for a little bit longer than it should. And it has been, plus as Oleg was going over about the licensing cost of things, it's a no-brainer. Fortunately for us, we got into, we're still in the free version of the license when we sign up for the OEM program. And when we expand outside of that and we eventually have to pay for our license, we will be a very successful company. So we'll have very solid foundation under our company that will allow us to move forward, and paying for the license is not going to be an issue. So it's a fantastic program. It really gives people the ability to see what Splunk can do. And, I think that we're a really good example of that. It started out as a concept. Evelyn, our platform, started out as a concept. And we were able to monetize and become one of the largest providers of remote healthcare in the United States. And we wouldn't have been able to do that without Splunk. And the OEM program has been a fantastic enabler for our company. And I tell people all the time, because I get people on LinkedIn that message me and ask me, how did you start your startup? What did you do? The different challenges you run into. And what I say is, don't try to reinvent the wheel if you don't have to. And pick something with a solid foundation with people that can support you, that have experience with it. And Splunk is a perfect example of that, is that we're not doing anything that somebody else hasn't done, but we're doing it in a different manner. And there's always people out there in the communities, in support, or just people that know other people from other Splunkers around the world that want to give their input and want to help us. And it's just been a fantastic program for us.
And I mean, it sounds, it's really good when you hear, I suppose, a solution being flexible and sort of a proposition getting developed that suddenly really caters for the needs of the early stage startup to really benefit from those fantastic capabilities that are often they're priced out of, I suppose, and like you say, not given the priority that they're required. I suppose, was there anything in your experience that you were, I don't know, skeptical about before going into it, and then actually found within the process that it was was actually pleasantly surprised, if that makes sense?
The licensing agreement. That was, I'm a cybersecurity guy. So when I get hit with a really large licensing agreement, it was a little bit intense, but it really does favor the startup. It's a good program. And here's running a startup. You're always there's quite a few SaaSes that we use, and you always start out at the free tier, and then you end up going to the professional tier. And then next thing you know, you're into the enterprise tier, and you're paying an arm and a leg. With this model specifically, I'm using the full capabilities as if I was an enterprise, as if a large enterprise ingesting a lot of data, and it's not costing me anything. It is absolutely fantastic. It really does enable you. It enables your startup, and it's something that there's a lot of worries that I have running a startup. Every day there's something new that comes up, but I never have to worry about Splunk. And that's a pretty big thing, considering that my entire business is based around Splunk. And
with that in mind, I mean, we haven't spoken yet about, I suppose, COVID, which was this extraordinary moment in time that we, are continuing to live through now. But obviously, that must have been a transformational time in your business. It would be really, really good to sort of go back to March this year and to sort of reflect on that experience and how you managed that and what that has meant for your business over the last six months or so.
Yeah, absolutely. So when AccuWealth first started, we started in the state of Texas, and we're still headquartered in Texas. We were entering into a program that had been well established for about 8 years at the time. And we came out with Evelyn, and very quickly, within the first year, we became the largest provider of remote patient monitoring services under the Texas program. We always had our eyes sight on the Medicare program, which I know this is a UK audience, but essentially it's elderly patients are able to qualify for government insurance. Mm-hmm. And we always had our eyes set on, hey, we need to get into the remote patient monitoring program for Medicare. We started building our program around that, and COVID hit. And what essentially happened was everyone says healthcare is in a recession-proof business. You hear that going around quite a bit. Doctors say, I don't have to worry about it because my patients always need to see me. But what they weren't prepared for was a pandemic where people can't go into the office. And all of a sudden, and we in cybersecurity say this all the time, what's your disaster recovery plan? And the physicians out there, big and small, didn't have a disaster recovery or business continuity plan. Enter AccuHealth. We have a platform that is scalable to any size that we need to scale to. We have a program that's already been tested for a year and is working. And we have devices that work in the patient's homes off of cellular networks and everything along those lines. We were able to go into physicians' networks across the United States, provide a continuation of care. So they were able to use our telemedicine component, which is built into our Evelyn platform, be able to see their patients, to be able to still have the face-to-face meeting, but on top of that, be able to monitor their vitals. And all of this is being done within Splunk. I have patients that are interacting with the Splunk UI. I have doctors, nurses, MAs, caregivers, all interfacing with the Splunk UI in real time, as well as seeing their patients. So we provided them a business continuity plan. And as you can imagine, we boomed. And our business went from, I think we were in about 3 states at the time, to now we're in 37 states, 36, 37, or 38. Mm-hmm. So we're growing quite rapidly. And in a lot of cases, doctors were losing money. And this is something that doesn't really happen too often, where doctors go out of business. This was unique. So when we were able to come in with a revenue solution for doctors, being able to use an established program that has been around for a couple of years, maintain their revenue as well as increase their revenue, continue on with their performance metrics so they get better data on managing chronic illnesses and keeping their patients, their chronically ill patients, away from the hospital. Because if you have obviously with COVID, if you have chronic illnesses, you don't want to get COVID. It could be very disastrous. So we were keeping patients in the care of their doctors, in the care of their physicians, remotely. And I have a lot of doctors that I speak to on a daily basis, and they tell me telehealth is it. There's always going to be a need for someone to go into the physician to push on your appendix or whatever it may be. But the majority of healthcare can be provided remotely. And patients are getting used to the Amazon effect, meaning I can stay at home and stuff will come to my house. And they're starting to demand that of services across different aspects of every industry. And healthcare is now just one of those. And to stay competitive, a lot of doctors are looking at how do I offer a telehealth service that includes not only video, but also includes being able to collect patient vitals. So it's COVID has been a disaster for the world, but I think it's been a blessing in disguise for telehealth.
And I mean, extraordinary how, and it sounds like an absolutely, a transformative solution, and incredibly valuable for at this time. I suppose you said the rate of your growth within the US has been exponential. I mean, have you got plans to expand internationally, or is that already in place?
Yes, absolutely. So I'm originally from Canada, so I do hope to bring this home to Canada eventually. Unfortunately, with telehealth and remote patient monitoring, there has to be a payer that supports it. And getting into a government organization to offer the services is slow. So we are in talks with bringing this to other countries. I do have patients in Canada. I have patients in Canada that are private pay. I have patients in Mexico who are private pay, and I have a patient as far as Trinidad and Tobago who's in private pay. We just started having a conversation with a team out of MIT that is trying to bring remote patient monitoring to Brazil. So we're starting to have those conversations as well. There's a lot of eyes on the United States for remote patient monitoring because the program has been around for so long. So we do have plans to expand outside of the United States. We actually just crossed a very major milestone for us, and we are now at a point where we're collecting 250,000 readings per month. So what that actually gives for us, and I know from a Splunk point of view, that doesn't sound like a lot of readings, but it's a tremendous amount of data on blood pressure, blood glucose, and weight, and SpO2. But what that's given us is a good foundation to really start our machine learning capabilities and predictive analytics. And with our EHR integration, where we're able to pull some more data on the patient, we're able to provide better data, enriched data to a doctor that allows them to understand what other doctors are doing across the United States for different chronic illnesses. So we're really excited about that component, that now we've reached that critical mass of having enough data to be able to show that remote patient monitoring works.
And within that, and not to go into sort of a technical deep dive, we can have that. So maybe we can have that as a separate session for the audience. But the medical data incredibly sensitive. I suppose with your cybersecurity background, I mean that must be something that is absolutely at the forefront of your mind always, mm-hmm. right?
Absolutely, and that's another reason why we picked Splunk. I didn't need to make up a platform that was supposed to comply with the different regulations that we have to comply with. With Splunk, like as I said, someone's already done it, right? So there's documentation out there on how to configure stuff in a secure manner. We obviously have to encrypt stuff, all of our data in transit and at rest, and then just exposing the Splunk UI to the internet is a different, that was something that I was a little bit concerned about. And there's enough tools that we have in order to make sure that that is secure for everyone that's connecting and everyone that's using our platform. So it's 100% always a concern for any organization, as it should be. But the fact that I built it on a platform that is already in the marketplace for over 16 years, I've been using it in some of the largest companies that I've ever worked for. It was a no-brainer for me to use Splunk because I knew that I was going to be able to keep my data in a safe and secure manner. The really important thing, or I think the most interesting thing, is that I have, when you look at the Splunk UI, it's nothing special. We have colors and numbers and stuff like that. When I first created Evelyn, we didn't really change much of the UI. But what we did do is we removed click and scroll fatigue for doctors. And every time I talk to a doctor about our platform, they tell us how easy it is to use, and how nice it is compared to the EHR. The second thing to that is that I have on a daily basis 80 and 90-year-olds logging into our platform, which is a Splunk UI, and interacting with Splunk, and they're actually able to get their readings. They don't have to do it, but for some reason they like to do it. They actually print out their readings before going in to see their doctor or before their telemedicine visit with their doctor, so they can have them right then and there. But it is a request that is growing, that caregivers and patients themselves are requesting access into Splunk, and we're giving them access to the readings without any fear of any sort of cybersecurity breach.
I love that. I mean, my grandfather's just about to turn 101, and he prides himself on still being able to email. So I'm sure he would love to have had the opportunity, or have the opportunity to do that. I suppose it really helps, I think, to add real color to the OEM program, and really sort of helping us understand the benefits through a real life example, right? And it's clear that there's huge benefits here for the startup community, and obviously we're as Lorca Live and our program is focused on supporting cybersecurity businesses scale within the UK market. So wherever they are in the world, we're looking to attract the brightest organizations and supporting them scale and grow within the UK market. And so we're delighted to be sort of partnering with Splunk in able to sort of offer this, offer an entry point, I suppose, to the OEM program. I suppose, Garen, it'd be just good to understand from your point of view the value that you see within. I suppose I know sort of the UK market and Europe and Israel is a really important area for Splunk to focus on at the moment. It'd be good to get a bit more background on that.
Yeah. When we thought, as I was mentioning, having been part of early stage startup organizations and gone through some things similar to what Stephen described, it's we wanted to be able to, as I was saying, provide something that does not incur cost on the startup until they are actually making revenue. And we thought, where could we have the most impact with that initially? And there's so much activity in the Bay Area and so much noise. We thought that we could see a lot more upside by investing, first of all, in the UK market. Just to be more specific, I would say the UK market and Israel, are the ones where we thought we would see the most productivity initially with the limited resources that we have. And that's why, we were thrilled to get an introduction from Splunk's corporate development team to Lorca. And beyond that, as an aside, I want to say, we couldn't be more excited to have Stephen and AccuHealth as our first, partner with this program. And we know how relevant, his use case and his success is globally, not just to the UK market, but that's why we chose to focus here first.